My recovery has been so simple, so easy. I feel so much better, so much more confident. This truly is probably the best thing that I've done for myself and for my confidence.
I feel like Dr. Barrett was just so sweet and just so like accommodating and understanding exactly what I wanted. I felt 100% confident that we were gonna receive the results that I wanted. I feel like the fact that I like looked at them, felt them, and we kind of came up with a plan together, that was the biggest difference for me, as opposed to just like kind of being surprised and not really knowing.
It was easier than I thought it was gonna be.
I literally only took Tylenol. It was super easy. I love my results. It's exactly what I wanted. I'm so happy I did it.
I mean, this is fantastic. It's healing beautiful.
I really didn't expect that I would ever have an actual cleavage line. So to see this natural cleavage line for me it's just so exciting.
Hey, how you doing?
I'm good.
Good. You look fantastic. I haven't seen a scar look this good at 6 weeks. So 6 weeks of scar like that, you guys, top notch.
Yeah, I think it looks phenomenal.
Yeah,
I really
absolutely.
do.
Yeah, no, it's great. Can you make your areolas smaller? Yes, you can. A lot of women are happy with their breasts, but the areolas are too big. This can definitely happen after breastfeeding, and there is a procedure to reduce the size of the areola and minimize scarring. It's an incision basically around the areola, and there's a special suture that brings in the breast. You can actually lift it at the same time, a small amount of lift, and can reduce the areola size using that purse string suture and a beautiful 5-layer closure to make sure that you don't have a visible scar ring around your areola. This is something you definitely want to do after you're having children. You wouldn't want to actually start breastfeeding after it, because then they'll start to widen out again, okay? Or if this is just how you were born, it can be done at any particular time. Recovery is around 2 weeks. Most doctors, most plastic surgeons can offer this. It can be done under local or it can be done under general anesthesia and costs anywhere from $3,000 to $8,000.
Dr. Barrett has done a chest reduction for me, which came out fantastic. And recently he did a revision rhinoplasty for me, and I was thrilled with that. Dr. Barrett is outstanding. Everything he does is meticulously done well. I have no anxieties at all about using Dr. Barrett, and I recommend him highly. Yeah, this is great.
Yeah.
What a difference.
Yeah.
I just want to thank Dr. Barrett for another job well done. I'm very, very pleased with the doctor, and Dr. Barrett's the only surgeon I would trust with my face.
Hi, my name is Jenny. I'm about to start a weight loss journey, and I wanted to open up and share why I'm going to be incorporating the medication semaglutide into this process. Now, the reason why I'm starting this journey is because I've truly just struggled with my weight my entire life. I've had many attempts before in the past where I've tried to get down to a healthy weight. Sadly though, at the end of the day, I just haven't been successful. So I'm really looking forward to this medication. I've heard great things about it. I've heard that it helps reduce your appetite and cuts down on cravings. Now, I'm a food girly. Food has been in my comfort zone for as long as I can remember, and I obviously don't have the best relationship for it. So if there's something that can help almost eliminate that food noise and help me focus more on developing better habits for longevity, that's a win in my book. Now, I haven't taken the medication yet. It's actually coming to me from Barrett Plastic Surgery in California. So it's coming straight to my doorstep, which love that for me. It has been officially 2 weeks since my first semaglutide medication. I started off at about 311, 310, which is the highest weight I've ever been. Officially, when I started my weight loss journey, I started at about 320. My clothes were kind of getting a little tight before, but now they are starting to fit the way that they need to. So I'm just looking forward to the day where I am gonna buy new things.
We're gonna do Daxify. We're gonna do some really special areas. A couple of these are really sneaker areas, like the bunny lines. Can you crinkle your nose? Those are bunny lines. We're gonna take care of that. We're also gonna do an injection on the side of the corner of the mouth. So if you have what's called resting V-face, okay, she brought it up, I didn't, okay, and you feel like you're constantly pulling down here on the side. Sometimes you can get Botox to counterbalance that depressor angularis oris action, and then it actually uplifts it. And then lastly, we're gonna do the masseters, okay? So that's a lot of grinding. If you grind your teeth at night, it's a home run, in my opinion. So, you ready?
Oh yeah.
Okay, all right, cool, we're gonna do it. All right, we're gonna inject the lateral brow. It's gonna give her a nice little lateral brow lift. Not that she needs it, but it's a nice perk in addition to getting rid of some of those lines on the side here. Her skin is very thin, so we're just gonna stay a little more superficial here for the next one. This is that little sneaker area, guys. A lot of people don't know about this. We're gonna do it just a little touch right here, and then just another one right over here. That's the hard part. Now we'll just do the masseters, okay?
We love that.
Yeah. She has a beautiful jawline here, but you can see there is a strong muscle bulge here. So go ahead and just bite down for us. Yeah, you can see, she calls it a golf ball. It's not quite, it's like more like a grape. And so we're gonna inject that area and soften that up for her, okay? When we inject here, we want to go deep enough to get into the muscle, not the subcu fat. Doesn't do as much good there. All right, so we just did our Daxify, and we did a couple of those sneaker areas, including the jaw, the sides of the mouth there, the corner of the nose, and the sides of the eyes. How did you feel?
I think it was great. You have a very good touch.
Thank you.
I didn't really have any pain at all, and I'm excited to see my results, and definitely excited to see how it affects like my grinding and TMJ.
All right, well, we look forward to any updates that you have, and I'll give you my card.
You know you'll get them.
Okay, here's my card. Shoot me an email if you have any
Okay,
questions, okay?
beautiful. Thank
All right,
you
and
so much.
good luck on everything. Hey, everybody, we're here with Bobby, and today we're gonna do just a minor little surgery.
We're getting a boob job.
We're not supposed, are we supposed to talk about that?
First, I'm coming in to get my hernias fixed. I self-diagnosed myself with some hernias because I thought my belly button looked weird. And Dr. Barrett agreed that it looked weird. He said it in those words too.
She's had 2 children, and she has a small little umbilical hernia and a little bit of extra umbilical skin that kind of sticks out.
And yeah, we're gonna get those fixed.
My name is Dr. Daniel Barrett, and I'm a board-certified plastic surgeon in Beverly Hills. I specialize in all types of plastic surgery, but my main focus is breast and body surgery. When my patients actually come into my office, they already seem like they know me. What they always tell me in the office is that you are exactly like you are online. And I think that's fantastic because we don't sugarcoat anything. What you see is what you get, and I think patients really appreciate that. It takes a special focus, a special artistic element to really keep the whole body in the picture, right? You don't want to do something that doesn't match the rest of your body, and I think a lot of surgeons miss that. They go in, it's cookie cutter operation, they get the job done, and sometimes the results are great, but sometimes they're not. I want to take the whole person in perspective and make sure that all the proportions match up so that you end up with a result that you're very happy with and it matches your body. We have studies that show that if we're able to decrease anxiety prior to the surgery, patients are going to do much better. Their anesthesia requirement will be much less. So there's a lot of things we do. We play calm music. If you actually request music, we can actually play that for you. We do meditations right before you go back into surgery. We do hugs. You need 7 hugs a day just to survive. I don't know if you know that. And so certain things like optimal health recovery afterwards, including IV drips, certain supplementation that we recommend, getting you off of traditional pain medications like narcotics and using CBD that I actually helped design that helps you heal after surgery, so that you're getting a comprehensive package that we're with you from the beginning all the way to the end so that you feel very well taken care of and you get back to your normal life as soon as possible with the results that you want.
Dr. Barrett, we're going to blind rank celebrity plastic surgery.
Okay.
Christina Aguilera.
4.
Lindsay Lohan.
That, you can't even put that on. Like, I don't even know if that's plastic surgery or if she was abducted by aliens, so you can't even put that one on there.
Donatella Versace.
You know, I've got to see a picture. I don't actually know, so leave that one blank.
Megan Fox.
2.
Kylie Jenner.
Do they? Okay. 5.
Madonna.
Oh, 8.
Kim Kardashian.
Do I have 7 taken up there yet? 7.
Bella Hadid.
3.
Anne Hathaway.
I could go number 1 with that. Megan Fox is close. 2nd.
Cardi B.
We'll fill in number 6 for Cardi B, but her personality is at number 1. How do you improve your scar? Well, I'm Dr. Barrett, I'm a board certified plastic surgeon, and scars are my worst enemy. Okay, so in addition to a lot of surgical technique, which is kind of beyond the scope of this video, there's a lot of things that you can do as a patient afterwards to improve the appearance of your scar. Number one is you want to protect your incisions. I like to use silicone strips that actually protect the incision, and they also apply a silicone pressure onto the incision and scar as it's healing to minimize the scarring. So there's a lot of papers that show the efficacy of silicone and silicone compression on minimizing the appearance of scars. There's a lot of burn surgery research that I've done into this. So I developed my own silicone strips to be put on after cosmetic procedures or any type of operation where you have a scar. Once it's healed, check with your doctor, but you can put a silicone strip on top of it and it will help protect the incision and minimize the scar. There's studies that show this. So if you're interested in checking this out, you can check out our Scar Shield strips at Barrett Recovery. You can click the link in the bio for more information. Thanks so much.
The care that's given in that office by every staff, from the person that you are greeted by when you walk in to Dr. Daniel Barrett himself, are all so gracious, kind, and like...
And I feel like you really connect to them.
Yeah.
You know, it's like a family there.
I used to live a life where I had to put on garments that helped enhance my body to give me the comfort that I want and the confidence that I want, because he's now enhanced my body in a way that it's given me that I can just walk around freely and like walk out of the house very
That's like the ultimate word. It's complete freedom. I feel like with this procedure, anyone looking for breast augmentation would feel freer and more themselves after they get it done.
It's still gender affirming care.
Yeah.
Whether you're cis or trans, it's gender affirming. If for any reason you want a breast augmentation to be something that boosts your confidence in yourself, boosts your self-esteem, then that's something you should pursue and do for you, because it's only gonna liberate you.
Yes. I've told all my friends.
I would bring my friends, family, coworkers, colleagues.
My mom.
a woman down the street, I would bring to Dr. Daniel Barrett.
Definitely.
Introducing the complete nutritional optimization for surgical procedures, okay? We have a before, we have after. These are custom formulas that I've designed myself and independently researched all of the ingredients in these specific products. Now, a lot of people don't realize that nutritional optimization is very important for how well you recover after surgeries, and it directly affects your results. This can be from cosmetic surgery, which I do. It can also be from like orthopedic surgery and a multitude of other surgeries. If your body does not have the right nutrients to heal, you will not heal properly, all right? We all know this with vitamin C and so on and so forth with other types of nutrients that are absolutely critical for your body to heal wounds and incisions and results after surgery. It's important to know that the nutritional optimization starts prior to your surgery. That's why we've developed before, and we have specific ingredients here that are gonna optimize, fill up your tank, right when you get to surgery, and then we have after, okay? And this is what your body needs after surgery to heal all of the different things that might happen for you after surgery. And inside of this, we have things such as, basic vitamins and minerals that you should probably already have. If you don't, they're in here. And we also have essential amino acids. Those are the building blocks to build new collagen and new and wound strength, okay, so that your wounds heal and they heal quickly, all right? There's a couple other things in here that are fantastic. We've researched all of this. It comes together or separately before and after. These are quite large, all right? Nutritional optimization takes a lot of work to make sure that your body has the proper nutrients. That's why we put all of this effort into these large supply bottles so that you make sure you get everything that you need for your surgical optimization.
I'm getting a BBL. I've been wanting it ever since I was in high school. I had a baby, and then around that time, I wanted to just be proportionate. I got a little bit more fat, so I wanted to use that to get that hourglass figure.
So we're about to do a BBL for our patient, okay? This is what her desired goals are. There's 2 operations in one. I'm gonna remove the fat and transfer it here. Let's go. The key to a beautiful Brazilian butt lift is to combine the liposuction in a very physiological way. And she has a lot of volume here. It doesn't look like it, but there is. And so when we do that, we're actually going to snatch in the waist here and then add to the buttocks. You can see she has a large hip dip here. We're gonna add posterior projection and fill in this entire area so that she has more of an hourglass shape. So if we turn around, you can see the front portion here, she actually has some fat here as well. And then if you keep going around here, we wanna do a good job on this liposuction. We can't just try to get the fat out of there. Yes, we wanna get the fat out carefully. We wanna define the abdomen as well and sculpt it. And by the way, we did her breasts about a year ago. They're 325 cc's, they look amazing. Now we're gonna balance out everything else with the BBL. So yes, even a skinny person with a tiny little bit of fat here, if we work hard enough, can get a BBL, okay? Quick recap, we did liposuction of the flanks. We did basically 360 all the way around, got 700 cc's off this tiny little patient of ours, and we're able to take some off the abdomen as well to flatten that out, which looks great. And then we transfer that to the buttocks, 600 cc's per buttock. Our goal, instead of this flat shape that she has here, a little more curved shape, so we focus on that C point directly with those minimal incisions. No one's ever gonna see that. All right, so the end result is gonna be more of this hourglass shape that we want. She's gonna be really happy. Now, the post-operative care after a BBL is pretty simple. Basically, no exercise for the first 2 weeks. You don't want to sit on your buttocks for those 2 weeks. We give our patients a special pillow so they don't put any pressure on it. We do compression garments for only 2 weeks, more if you feel comfortable with it. Otherwise, it's not necessary. And then as the fat starts to absorb, we look right around the 3-month mark to see how much is actually remaining. And that's generally around about 60 to 70% of whatever we transfer stays there. So that's why we try to transfer as much fat as we can. She's gonna have a great result here. We are here, we're gonna do a combination procedure for lip rejuvenation for Kelsey. Kelsey has actually never had her lips done before, so we're gonna do a combination of a Botox lip lift and a little bit of filler to add some volume. Her main thing is when she smiles, her lip, upper lip thins away. Tell me if that happens to you. We're all done with the needle. Gonna do a little massage, and then we'll finish with the lip flip. We're moving on to the lip flip right now, and this is just a little bit of Botox to combat both the little gummy smile and to evert the lip, to go have it come out, to see the redness that's underneath there. So that combination procedure is a home run, you guys. Let me take a little bit of hydrogen peroxide and I'm gonna clean this up. I'll show you the work that we just did. Now this is gonna swell. Anytime you get your lips done, it swells within the first 24 hours. So she already knows to expect that, and then ice for the next 24 hours or so, but I'll show you the mirror here. There we go. Boom.
Ooh.
Dr. Barrett, I'm introducing my sleep bundle. This is a combination of my CBD. This has no THC, doesn't get you high, but it does have high quality organic CBD in it. And what it does, CBD, if you haven't tried it, if you put a few drops underneath your tongue, you let it sit in, helps you get better deep sleep at nighttime, all right? Especially if you have problems like waking up in the middle of the night, this is a game changer. The other thing is magnesium. Magnesium, all of us are deficient in it. All of our food systems don't have enough minerals in it, including magnesium. I like my product, it has 7 different types of magnesium in it. If you look at a lot of the stuff you get on Amazon, it only has like 1 or 2 types of magnesium. They all have different functions and they can all be absorbed differently. We put this together so that you get the better absorption of magnesium, and it helps you sleep at night, helps relax, helps decrease anxiety, helps with muscle spasms after surgery. That's why that's the main reason we brought it on, but it actually helps with sleep a tremendous amount, especially in combination with the CBD. Check it out.
Well, let's talk about red light.
Yeah.
Because I'm every night, I do my red light, and if I stick to it, I see a difference. Yeah. Like if I am like, Ashley, don't around and procrastinate every single night,
Yeah.
even like 7 days in a row. And I try to do it every day, but sometimes, and then you travel. But if I really am like, I'm committing to this, I don't want to skip a night. I've noticed such a difference.
So this is wild. This has come out of the probably 2019. I kind of caught wind of this, and it was through a podcast with this guy named Ben Greenfield. And he talks about red light, these red light panels, and I was like, what the hell is all this? You know, red light, and it's a specific wavelength, 680 nanometers, and it doesn't have like UV. Like you know, like when you go outside, you feel good when you're in the sunshine. You know, obviously not too long, you start to bake and you do all this UV damage. But there's something about sun that's really kind of beneficial, and majority of that is the red light that comes from the sun. And so if you can isolate that red light, which is around 680 nanometers, and some infrared as well, which is a higher wavelength. It's beneficial. It feels good. It helps with pain. It helps increase blood flow. I do it for all my surgery patients. It speeds up the recovery, as you know. And it's great for reducing wrinkles and increasing the collagen in your skin. And there's lots of studies that have shown that it does that. So, and there's virtually no downside to using red light, as opposed to using skincare. I mean, like there could be other chemicals in there. You know, we could, you know, there's other stuff that we don't fully understand about products that we put on our skin. But when it comes to just, you're putting just red light on your face, I would say that's one of the easiest no-brainers that anybody could do. One of the most common trends right now is neck rejuvenation. People are looking at their phones and they're like, oh my God, what the hell is this? So you can do this right now. You're on your phone, check it out. Do you have a double chin? Well, there's a couple ways to treat this. A lot of people ask, well, can I just do liposuction? And yes, if you don't have a whole lot of extra skin, a little bit of neck liposuction can get rid of that stubborn little fatty area. If you have a lot of extra skin, if you had a lot of weight loss and so forth, you might benefit more from a neck lift. Now that's a little more invasive. Neck liposuction is a tiny little access point, 3-day recovery. Neck lift is a big incision back in here, done well, it can look really nice, but the recovery is about 10 to 14 days. Now there is a middle in between, okay, it's called like a no-scar neck lift, and that's where you use combination of liposuction, energy-based devices to tighten the skin from the outside. It's called no-scar neck lift, something that I do for those of you that are in the middle between those two. How do you improve your facial beauty or harmony? I'm Dr. Barrett, I'm a board-certified plastic surgeon. Stay tuned to the end of this video and I will tell you how much some of these treatments cost. Well, first thing to understand, what we learn in plastic surgery school is that our face is divided up into thirds, okay? So its characteristic harmonious face is a third, and a third. So when you go visit a plastic surgeon, those proportions are analyzed. A frequent area that in our modern society, we have retrognathic chins. We don't have jawlines anymore because kids aren't breastfed, soft diets in the food, we're breathing through our mouths. All of those things can kind of contribute, and other things as well, to smaller jawlines. So if you have a third, and then 20%, a chin implant or a filler option could be a good idea to kind of enhance your jawline. The other idea is in response to facial aging, we lose that kind of fullness in the mid-face, not on the cheekbone, right? You'll see that where people will fill up here and you look like you got these big lion cheeks. That's not what I'm talking about. I'm talking about replenishing volume as you hit your 3rd to 4th decade in life of the middle cheek compartment with filler in a very careful way, with a more durable filler, more natural filler like calcium hydroxyapatite or Sculptra, right? Which kind of generates its own collagen versus using hyaluronic acid. When it's overdone, it's not, in my opinion, great. It can cause a boggy appearance and can kind of clog lymphatics, according to some studies. The other portion of that is facial symmetry. Now, everybody has a big side or small side to the face. So if you can do some things to kind of balance the severe discrepancies, but you don't want to chase certain things. Everybody has a different side to the face. In fact, if you were to take a mirror image of somebody on one side versus the other, it would look sometimes kind of uncanny, it would look weird, right? A little bit of things to help improve symmetry can help, but sometimes if you try to add volume to simulate bone structure or muscles, it might end up looking weird, so I don't always do that for people. Those are some basic things. Filler ranges anywhere from like $500 to $2,000 per syringe based on where you go, and a chin implant ranges anywhere from like $2,000 all the way up to $15,000 depending on where you go. Let me know in the comments if you guys have had any treatments and you think it's helped your facial symmetry and balance.
My name is Morgan. I am a social media influencer and an actress. I do a lot of filming, and I noticed while filming and seeing a lot of the behind the scenes footage of it, I have like a little bit of like a pocket of fat here. You can kind of see it. I did Kybella at one point in my chin and it didn't do much for me. It always stays, no matter how fit I get. I even like was doing like workout classes and stuff for a while, and I was in like the fittest point of my life like 2 years ago when I got Kybella, and it was just there. There was nothing I could do about it. So I think now I'm sort of ready to be like, okay, I'm ready to actually just get after it and get like an actual procedure in, and then I can feel good about it. Today I'm getting neck / chin lipo. I don't know exactly what the term is, but I'm getting rid of this little pocket of fat underneath my chin. I feel like for other people, you know, it's probably something where they're like, oh, I didn't even notice it till you pointed it out. But for me, I sometimes won't even watch some of my stuff back because I'm like, I can't believe I look like that. And I know that's like such a weird thing to say, but I always notice it more than anything else. So for me, it's gonna be a game changer for sure. But if you're gonna do something, you know, make sure you're doing it for you. Don't do it for anyone else. I'm doing it for me. Obviously, no one else is gonna notice it the way I do, but just do things for yourself. Life's too short.
Recap, chin liposuction, took off this extra fat area here, about 100 cc's for her. Wasn't that much, but it was in a discrete pocket area. We broke that up. She's gonna have a little bit of swelling for about 3 days. We're gonna wear a little garment there. Other than that, you could do this on a Friday and be ready back to work on a Monday. It's my favorite procedure to do in terms of downtime and results, okay? A little bit of swelling that she's gonna have, otherwise there's no pain. I like it better than Kybella, which takes 5 injectable treatments. It actually ends up being more expensive. She's gonna have a great result here. Final results typically around 6 weeks, but she will look good right around 7 days. If you have any more comments, questions, feedback, leave it out here on my YouTube page. And don't forget to give me a thumbs up and hit subscribe if you want to see more cool videos just like this. Thank you.
So today I'm getting an abdominoplasty, which is a tummy tuck and some liposuction. 52 going on 53. I have had 2 children. My oldest is 36, my other child is 13, and I was pregnant with my second child at a later age, 38 years old. So at that point, after I had her, my hormones, they were out of whack. After my second pregnancy, I was never to go back to my original self or to my pre-pregnancy self. I always said once I turned 50, I would consider this type of procedure just to make me feel better overall. Dr. Barrett is trusted in our family. Since my family trusts him with their procedures, I definitely would trust him with my procedure. I've seen the results with family members, and it's wonderful. I am sure this is going to turn out wonderful as well. We all have a right to feel good and confident in our own skin, and I think that if this is going to make you feel better about life in general, then do it.
Hello. Hi, how's it going? Give me a hug. Welcome.
Yes, thank you so much.
Everybody, here's our beautiful patient. Today we're going to do a tummy tuck. She's had 2 children. She has beautiful skin. She looks pretty good, but there's an extra amount of skin here she wants to get rid of, an extra volume of fat, okay? So we're going to take that out with our high definition liposuction, really give her some definition to her abdomen, improve the belly button appearance, because right now you can see that it's kind of hooding and there's a previous scar. That's all going to go away with our belly button improvement there. And then we're going to bring all this skin all the way down here and hide the incision and the bikini line. So stay tuned. So you can see our plan here. This is where we're going to take off and we're going to snatch the waist here, and then we're going to make our incision down here. Okay, so when this comes up, you know, if she's wearing a bikini, you're not going to be able to see that. Okay, and this is all going to be flat. We're going to redo her belly button for her. We'll make it look better, and we're going to focus on that so that you're not going to be able to see a scar there. So that's our plan today.
The recovery has been better than I anticipated. The first couple of days were a little rough. But I had the support of my daughter, you know, getting up and going to the restroom and doing certain little tasks like that. After day 2, it's kind of been surprisingly very, very like easy. I am self-reliant. I don't rely on her for anything, doing my own showers, they're doing my own thing. It's better than I anticipated. Honestly, I would never, ever show my stomach, my midsection, ever. I feel like I would actually, like 1 week out, I would show my midsection. It's amazing. It's amazing. It's just like magic. So I did try to take, for the first day, I tried to take the pain medication, the hydrocodone, and it was horrible. It made me horribly nauseous, so I couldn't do that. So I stopped that and I turned to the CBD oil, and it just really helped relax me. It took the edge off the pain. I have done no pain medication since that first dose of hydrocodone, and I've been just fine. I mean, so seriously, it's awesome. Any mom who's gone through pregnancies, any female who's gone through menopause, and you feel like you're not your old self, and you may be working hard at it, your skin is still very lax, your muscles are still not tight the way you're used to them being, do yourself a favor, get this procedure to make you feel like your old self. 1 week out, and I feel so much better. My confidence in 1 week has skyrocketed, and I'm anticipating as I heal even more, that I just continue with this momentum. I would highly recommend do this for yourself, just to make yourself feel better physically, mentally, emotionally. I think just it encompasses what needs to, what we need for ourselves. It's just upkeep.
Magnesium. Here are 3 signs that you could be deficient in magnesium. In fact, I guarantee if you're not taking magnesium, you're deficient in it. We just don't get enough in our diet anymore because our soils are depleted. One sign is that you're not sleeping well at night. That is probably the #1 thing that tells you that you are deficient in magnesium. And so if you're having difficulty sleeping, falling asleep, or staying asleep, start taking some magnesium at nighttime before bed. Number 2 is muscle cramps and spasms. So if you don't have enough magnesium in your blood, you tend to kind of have more muscle cramps and spasms. That could also be other electrolytes, but magnesium is one of them. Last one is you're constipated all the time and you have problems, with moving your bowels. So magnesium is definitely needed for gastric motility and intestinal motility. So if you're short in magnesium, that will contribute to constipation and make it worse. So that could be something you try out. My product is called Calm. I've got 7 different types of magnesium, so make sure you look for magnesium glycinate, a bunch of other different types of magnesium so that your body can absorb it properly, not just mag citrate, which doesn't get absorbed very well. But just do your research on them and let me know in the comments if you have any other symptoms that are improved by taking magnesium. This is Daxxify, everybody. You've had this in the past. How did you like it?
I liked it a lot.
How long did it last for you?
It's even, I feel like, still pretty strong in there.
Yeah. So Daxxify, we like it. It's a neuromodulator, kind of like Botox, but it lasts a little bit longer, kicks in faster, and it gives your skin a nice glow. Did you notice any kind of a skin glow with it?
Yeah, my skin looked amazing.
Yeah. All right, cool. So we're gonna get started with that. Kelsey has a couple areas that we like to do: forehead, brow, sides of the eyes, and we're actually gonna do the masseters as well today. So that's gonna be a new one for you. Mm-hmm. So sometimes it can have a little slimming effect, but the main thing is to help improve grinding, right? Okay, so here we go. So part of this is crow's feet. We're also going to do a little brow lift with it. So we get the lateral tail of the brow to come up just a tiny bit. And then I also go a little bit underneath the eye to get some of these little wrinkles that happen right here. But you got to be careful. You can't do too much there. All right, so we're going to do the masseter next. Do a product called calcium hydroxyapatite on the under eye area. I like this because it builds collagen. It doesn't give you that clogging lymphatic effect of hyaluronic acid based fillers in the under eye area. The last final touches is an area I don't like to do a whole lot, but occasionally we do a little bit of filler. That's the nasolabial lines, okay? People talk about these all the time. If you overfill them, it's not good, but just a touch here and there is okay. We are done. Not with the ice pack, because she's gonna need this. So we just finished multiple of areas for the Daxxify. That kicks in 3 days. Another reason I like Daxxify. And then also the filler that we did, just gentle filler around the eyes, a little rejuvenation, a little pick me up, and then the nasolabial lines very carefully. I think maybe next time the lips. Right now the lips are good. We never want to overfill the lips. A lot of people magnify on their lips, and less is more there. So that's it. You know, things are going to probably look good right around 2 weeks. You have a little bit of swelling first few days, and you're good to go.
Awesome.
So
thank you.
Thoughts on this treatment? How'd you feel?
Easy. Perfect.
All
Ready
right.
for the holidays.
Despite all the tears. All right. See you guys. Dr. Barrett here. I'm announcing my new supplement. It's called NMNH. It is a precursor to NAD. If you don't know what NAD is, it is an essential coenzyme in all of your mitochondria. As we hit the age of 40, we have half of it in our body as we should normally have, okay? So if you take this on a regular basis, your NAD levels will increase. So I take it every day. Interested in this product, click the link in the bio or go to postoprecovery.com. Here is our beautiful patient, you guys. We're going to do lip filler for her. We're gonna do this in a very natural way. That is my thing. But the first thing we're gonna do is we're gonna numb up the area. We wanna numb up the area because it lowers the blood pressure. Make sure your provider numbs the area appropriately because you're gonna have a much more pleasant experience. What we really want is we wanna feel like our lips are in a different planet. So our goal for your lips is to do overall volumization in a very natural way. So you have a beautiful Cupid's bow. A lot of people make the mistake and they'll do a sausage lip formation here by blunting this, by going into this vermilion border. We don't want to do that. We want to stay in the vermilion under here and kind of uplift and outwardly naturally modify the lip so that you don't get sausage shaped lips. That's a very unnatural look. So we're going to do that in a way to bring out her corners, the fullness of the upper lip naturally, and then a touch on the bottom lip because her bottom lip is actually looking pretty good already. So we're just going to use a smidgen down there. Cool. We're going to get started, and then make sure you take a deep breath in and exhale slowly through the nose. Good. All right. Just keep breathing through your nose. You want to breathe through it if you feel any kind of sensations that you don't like. A little pinch. Perfect. How's that?
Very painless.
Good. So I'm just going to kind of move back and forth. So we're going right in the vermilion border. You don't want to do any edge defining techniques because they end up blunting that and scarring that area over time. You want to preserve that junction and not mess with it. Also, the lip filler will migrate. If you put it right into this border, it'll migrate up. So your lips will end up looking like Homer Simpson. We don't want that. We want to stay in the vermilion, have it underneath there so that we don't mess with this junction that's right on the border of the skin versus the vermilion, which is the red portion. All right, so I'm just gonna do a little check-in to see where the filler is. You doing okay, good?
Yeah.
All right, great. And let that numbing medicine kick in just a little bit more. Tiny little pinch here. Now I'm gonna do some Cupid bow highlighting. A little pinch here and here. Okay, and then we do a tiny bit in the center. This one kind of stings always a little bit. Okay, a little pinch. Beautiful. Kind of take a step back, and I always check for balance. Okay, it's balanced out pretty good. I think I need to put a touch bit more on this side. Give it a little more volume, and then we'll adjust the bottom lip. When I first started doing lip injections, it used to take me about 45 minutes. I've done thousands of them at this point, so it doesn't take me quite as long. But again, you really want someone who's kind of efficient and knows what they're doing, because as we go, the lip starts to swell, and if it swells up too much, you lose the anatomical borders and landmarks, and it makes it harder. So you want someone who's efficient and does this on a regular basis, but not too fast where it's really painful. Okay, now we're gonna do the bottom lip here, a little pinch. We don't want to forget about the corners. So overall, how's the pain feeling?
I haven't felt anything. I felt a little in the center, the part that you said might sting, but
Yeah.
other than that, nothing.
Previously, you had your lips done before, right?
And it hurt. Like,
it hurt a lot,
felt
right?
like needles everywhere.
Yeah, exactly. This
And I numbed a lot longer.
Last time?
Yeah.
Yeah, this stuff is amazing. It's our little secret. Now that was about 1 cc of filler. I never want to try to do too much filler at one time. Occasionally, the most I've ever done was 2 cc's at one time. But the best way to do this is just to kind of add a little filler, wait a couple weeks, and add a little bit more if we need to. But I think this is actually a totally good amount for her for the next 6 spots. Let me know what you think.
It looks really good. It is really natural. I like it a lot.
Good. All right. So that's it for our natural lip augmentation, you guys. So a couple key things I just want to remind you of. Go to a qualified injector. We stayed within the boundaries of the Vermilion. We didn't do any crazy different types of injections. We made sure that the procedure was painless for her. And then we did lots of massage at the end. Okay, results typically last 6 months to 12 months. And there can be a little bit of bruising, so don't do this before your wedding night. Give us a few weeks at the minimum before an important event.
Guess their age.
Okay.
Guess if they're natural or not. And then say what you think they've had done.
Okay.
Okay, so the first girl is Jess.
She's 38, lips, nose. Yeah, so obviously she's had some work done, in my opinion.
This is Harriet.
42, yes. Cheeks, lips, nose, Botox.
Everything, probably. Med spa wise.
Yeah.
And then this is Nicole.
Are those two different photos of the same person?
Yeah, they're the same person, but two different photos. This is like her on Instagram versus her like, yeah.
She's 35, lips, veneers, Botox, maybe a little cheek filler.
Next one is Samantha.
32, lips, veneers, nose, cheeks.
Do you want to get her
Botox.
ages just for fun?
Yeah.
Okay, so Samantha is 26.
Oh God.
Nicole is 24.
Oh my God.
Harriet is 24.
Oh my God.
And then Jess is 25.
Wow. Yeah, I mean, obviously I don't watch this show, maybe I should, but this is crazy. Yeah, I mean, I think that, you know, plastic surgery and injectables done incorrectly can make you look older. Boy, I was really off.
What do you do afterwards for scar reduction?
Scar reduction, it starts with your inflammatory state in your body. Okay, so I want people to be healthy, not stressed out going into surgery.
Yeah.
We want to handle the tissues minimally during surgery. So there's a lot of surgical technique involved. I'll spare you with a lot of the details. And then the closure. I close all the breast incisions in 5 layers. It's kind of like lasagna, right? You know, 5-layer lasagna, bring all the layers back together very precisely. Your body's like, oh, nothing happened. Like this is, hey, you were just here, and you put it right back together, right? So it doesn't need to put out all the scar tissue to close the gap. We tape all of our incisions for 6 weeks afterwards, and that prevents little micro movements in the skin so that it has time to develop that strength across. And then at 6 weeks, we start a scar gel. I recommend Scanuva. It's not my product, but I think it's the best product out there right now. Has silicone gel in it, has some fetal growth factors in it, and I think it has some lightening agents in it too to help reduce pigmentation. We do that for at least 3 months afterwards. And then if we have to after that, we can do a little CO2 laser on top of that. And that's been our secret to minimizing scar. It's not our secret. We tell everybody. We tell other surgeons, you do this. Because, you know, it's like the more we make plastic surgery more mainstream and less complications, the more people get plastic surgery, the more that we all benefit. And,
Yeah.
And I feel better
It's
about
actually
that.
such a great way of thinking about it. So it's like, I respect that.
My recovery has been so simple, so easy. Everything just fell into place. This truly is probably the best thing that I've done for myself and for my confidence. My name is Josephine. I'm getting a breast augmentation today. I'm super excited. I've been waiting for this for so long. My motivation behind getting this is actually seeing the results out in person. I've been out before and I've actually asked 2 different girls where they got their breasts done and they both said Dr. Barrett. So I said, you know what? I've seen it in person. It looks so good. So why not go to him? Definitely find a doctor you're comfortable with. With Dr. Barrett, as soon as you walk in here, him and his whole staff is so welcoming and I feel like nurturing. That's the best way I can describe it. Obviously you have these nerves, but to be surrounded by like such good energy really like calms you down. And I'm actually excited to go into surgery. Also, I feel like a big part of this is the before supplements. He also has after supplements that I'm gonna be taking, but I felt super confident in taking the before supplements because it was getting my body ready. No matter how good we eat or how much water we drink, we still are missing nutrients. So I feel like that really made up for what I was lacking. So I feel like him kind of putting me on to these vitamins before made me feel like my body was gonna be even more ready and more optimized. So my nerves are like more calm. Like I feel good. I'm excited.
Hello, how's it going, Josie? Give me a hug. I'm good. How are you doing?
Good.
You
I'm
ready
so
for
excited.
today?
Yes.
We're gonna do an augmentation for her. We're gonna do the border of the areola incision. Now, one thing to note is you see, she's very petite, okay? So we need to make sure that we don't go outside her base width. So the base width is kind of like your shoe size. It's a bad analogy, but here it is, 12 centimeters, okay? So if you look, the largest we can typically go with a 12 centimeter is right around like, almost like 375, 400. This is a 350 for comparison. We might be able to get this in. We're gonna start with a 300 cc sizer, see how that looks. We're gonna keep it underneath the muscle, all through a tiny little border of the areola incision. I don't like to do inframammary incision because it can bottom out, and we're gonna develop the cleavage, side boob, everything else. So get excited, stay tuned. Breast augmentation, quick recap. We pre-injected numbing medicine. So when she wakes up, she's not gonna feel a whole lot of pain, right? That's really important because the spinal cord can feel pain from the body even though the mind is asleep. So that's step number one. Next thing we did, we made a tiny minimal incision, even though we used a slightly large implant of 300 cc's, tiny little minimal incision to use our special instruments to get in there and dissect the pocket partially underneath the muscle for a more natural looking result. Triple antibiotic irrigation, color funnel no touch technique to get the implant in so that we get less risk of capsule contracture and those other complications. Okay, that takes a lot of time, but it leads to a better result, less complications for her. We did our sizing on the table to make sure that that 300 was perfect for her, and it was, compared to the body and everything else. And then we close it up in our 5-layer closure, and we put our special silicone strips. If you are thinking about getting the surgery, you can get those strips on our website, postoprecovery.com, if you're not gonna come see me, okay? We also have a whole other line of supplements you can check out at postoprecovery.com if you're thinking about getting breast augmentation surgery somewhere else. Of course, we'd love to see you here, right? If you have any questions about this, you can check out my website, drdanielbarrett.com. And if you're really interested, you can submit a virtual consultation form up on the top to give us more information so that we can see if you're a good candidate for this particular surgery. As always, please feel free to leave your comments, questions, feedback right here on my YouTube page. Give me a thumbs up and hit subscribe if you want to see more cool videos just like this. Thanks for watching.
We are about to get to our 2-week post-op appointment. I cannot believe it's already been 2 weeks. I'm feeling and looking so great. I'm doing almost everything completely normal, getting all of our stitches removed today. I can get a better idea of what they're fully gonna look like. I cannot believe this surgery has been so easy. Here we are in the office. This is actually the exact room I was in before surgery, so it's exciting to be back here post-op and just kind of like remembering like all my feelings, how I was sitting in the chair. And like I said, remove the stitches, and I'm going to let you guys know how that feels. Now that they're out, I feel so much more comfortable, and I can actually stop wearing my surgical bra. The surgical bra, it's not uncomfortable, but it's pretty thick. Like it kind of is giving like maternity bra, which is not a problem, but it's not really the look that I'm going for. Other than that, the next time I'm gonna see him is actually 6 weeks from now, so I will keep you guys updated. So I am 6 weeks post-op, which is crazy because the time has just flown by. My recovery has been so simple, so easy. I feel like after about 4 days, everything just fell into place. My boobs feel like they're mine now, and yeah, I'm just really happy. I was looking at my before pictures and I look at my after pictures, and I can see the confidence just like radiating through the pictures I have now. And even just walking and wearing my regular clothes, like out in daily life, I feel so much better, so much more confident. This truly is probably the best thing that I've done for myself and for my confidence. I have talked to many friends. They have seen my results and they've asked me how my recovery's gone, and I always tell them, do not be scared of the pain as long as you go with somebody who is very experienced. And I always recommend Dr. Barrett because the recovery process and the way that him and his staff have guided me through the process has made it so simple and so easy. Like I was mentioning, even 4 days post-op, I could not believe that I had just had surgery. For it to be this simple, if this is something that you guys want to do and you have always thought about it, I highly, highly recommend you do it, especially with Dr. Barrett because he makes everything so seamless.
So Josie's here. This is 6 weeks out, you guys. This looks beautiful. She just got back from her trip and she looks gorgeous. If you haven't seen her Instagram, definitely check it out. How can people find you?
Dose of Jose.
Dose of Jose. We'll tag it right here so you guys can see it. She looks amazing. She's only 6 weeks out. We're starting massage today. We're doing our scar management with these strips here. And in addition to our scar gel, you guys, she is looking fantastic. She's just in time for summertime, so she's gonna send us more photos. So can't wait to see those.
I can't even believe it's been 7 months. It has just breezed by. I've had no complications and I get so many compliments. I've heard and seen so many different breast augmentation results, and I cannot believe that my scars are virtually non-existent. They're literally not there. If you don't want people to know if you got them done or not, I highly recommend Dr. Barrett because truly, if I didn't tell anybody, I don't think they would know. There's some surgeons who will just do whatever, but I love that Dr. Barrett really does what's best for your body type. Honestly, me coming into such a unknown field in surgery, I didn't really know what I wanted, but I feel like he looked at my body and picked the correct sizes for me, and honestly, I could not be happier with the sizes. I can wear like this like athleisure wear and not have to stuff in my bras or like super padded bras. It feels so good. I can wear any shirts, try anything on, and I feel super confident. So definitely the confidence.
Hi, how you doing? Good to see you.
Good. It's been
You look
so
amazing.
long. Thank
How long has
you.
it been? Has it been what, 4 months?
You guys tell me.
7 months?
See?
Oh my God.
I said the same thing.
All right, so we are out 7 months, you guys. They still look fantastic. 300 cc's matches her body perfectly. You cannot see the scar. And totally natural, guys. Beautiful shape. Already nice teardrop shape here. Perfect cleavage, side boob, everything home run. Why you need a red light panel? It's very sturdy because I made it myself, and has low EMF because of this metal case. The red light has been shown with numerous studies. It's a photomodulation device, basically improves blood flow to any area that gets it, right? So it's the same reason why, like, if you go out in the sunshine, it feels relaxing. Your dog is in your house, in your apartment, it sits in a little spot of light for a reason. It feels good. That infrared and that red light feels good, in addition to some other wavelengths. But the harmful ones that you get from the sunshine, like UV light, you don't get with a red light panel, but you get all of the benefits, or many of the benefits. You know, 640 nanometers, red light's been shown to improve blood flow, increase collagen in surgical site areas. So after surgery, this is a definite must if you want to recover like a boss after surgery, and if you want something long lasting to help with joint pain, just regular aches and pains. Like last night, I did this on my back after I had a long day. It just totally relaxes you, feels really good, and it helps with anti-aging and wrinkles. Studies have shown that if you do it on your face 10 to 20 minutes every day, you will have less wrinkles. So red light is the way to go. Everybody should be doing it at least 10 to 20 minutes a day until something better comes along. This is a no-brainer.
Hi everyone, my name is Salzea. I am 21 years old. Today I'll be doing a breast augmentation today with Dr. Barrett. I am so excited. I've been wanting this since I was young. I've gone to multiple consultations with different doctors, but Dr. Barrett really checked all of my boxes. I am definitely looking forward to wearing bikinis. I want to be able to feel comfortable in my body. This summer I'm so excited. I will be going to the beach every day. Can't wait to feel comfortable in my body. So yeah, and clothes.
Good morning. How you doing? All right, so we're gonna do an augmentation for her. You can see that she's very petite. She's 4'11". This is an implant. This is a little too big for her. That's 300 cc's, all right? But we're actually, I know, don't worry. We have a smaller size plan. We're gonna start with 250, right? Because 300 would be too big for her, but some other people would be smaller. So we're gonna do some on-table sizing, make sure we get the right sizing for her. We're gonna do all through the border of the areola, and then we're going to kind of develop that cleavage and upper bowl fullness and keep it natural at the same time. So stay tuned, I'll show you how we do it. Let's recap the steps. We started with our pre-injection and numbing medicine so she doesn't have pain when she wakes up. That's a rapid recovery technique that we do. Then we made our border of the areola incision. We released the pectoralis just delicately here to give her more cleavage. A lot of surgeons don't feel comfortable doing that. We were able to do that to give her that more natural look, keeping under the muscle, but also that medial cleavage area. We used a 250 cc sizer. On-table sizing turned out great. We used a 250 cc moderate profile plus mentor, a little bit softer, what she wanted for her final result. We closed it up from 5 layers. We did some additional numbing medicine so she wakes up, she's not in that much pain, okay? So if you are interested in this type of procedure, check out my website, drdanielbarrett.com. I have a virtual consultation page. You can submit your information. If you're getting this procedure somewhere else, hurts my feelings a little bit, but it's okay. Check out postoprecovery.com so you can get the CBD balm, and the magnesium to help you recover faster and not have pain after a surgery like this and have to rely on the narcotic medications, okay? If you have any other comments, questions, feedback, please feel free to leave it right here on my YouTube page and I will get back to you. Give me a thumbs up and hit subscribe if you want to see more cool videos just like this. Thanks for watching.
Today officially marks a week and 1 day from my breast augmentation, and my body feels good and I feel good. Day 1, I definitely felt pressure and tightness around my chest area. There was minimal pain though, and every time I would feel like that, I would just slap this on. The CBD balm literally helped me through my recovery. Keep in mind, I never took the narcotics that Dr. Barrett gave me because honestly, I didn't need it. There was barely any pain. I only took Tylenol, the CBD balm, yeah, and the oil. And trust me, those 3 are your holy grails for a smooth recovery. Recovery isn't as bad as what people make it seem. And I would do this procedure 10 times over and over because it was easy. Definitely think the reason why I had such a smooth recovery is because of my doctor. I truly think that Dr. Barrett is the best of the best, and I'm so happy that I chose him. This whole process was so much easier than I expected. Dr. Barrett really knows what he's doing. So this is my 6 weeks post-op, and I am feeling grateful. I'm just feeling all of the emotions, good emotions. I'm obsessed with my new boobies. It's only been 6 weeks and I don't want them to change. They already look so good. I feel like a new girl, if that makes sense. Like the past weekends or the past weeks, I've been really getting ready. I've been trying on buying new swimsuits. I've been buying new clothes, and my energy and my confidence in general just boosted through the air. And it's just an amazing feeling. It really is.
All right, guys, we can check it out. Say, yeah, here we go. Hey, how you doing?
Good, how are you?
Good, give me a hug. Good to see you.
Well.
6 weeks.
I feel amazing. My body feels amazing. My life completely changed in a great way. My confidence has boosted. I feel good within my body. I've been going to the beach every weekend, you guys, wearing these tiny swimsuits, showing off my body because I'm just obsessed with the new girlies and new additions. I know people are scared. They're like, I'm too scared to get this and that. Like they're scared to get breast augmentation because of the surgery, but I personally think that it's worth it, and it also depends on your doctor, and I'm so happy that I chose Dr. Barrett to do this. So thank you, I'm so happy, so happy.
So here we're going to do Daxify, my favorite neuromodulator, you guys. It's very similar to Botox, except it has a few extra perks. Number 1, kicks in faster. 2, it lasts about 50% longer. And 3, it gives your skin a nice glow. So you're going to love it. The only downside is a little bit of sting. It's kind of a little bit spicy when it goes in. Yeah. The areas we're going to do for her, again, we're going to do the forehead. We're going to do the brow, a little bit of lateral brow lift, and then the masseters to kind of calm that area down for her. So stay tuned. We're gonna do a brow lift, all right? I'm gonna show you how I do it. We're gonna do just a touch of it right here on the lateral brow. She has beautiful eyebrows here. How was that?
Good.
Not bad, good. And that's gonna lift this up, right? Just a tiny bit. All right, that's the hard part of today, guys.
We did it.
Next step, masseters, you guys. So if you want, go ahead and ice this side over here and display the Barrett logo proudly right here.
Yes.
No, just kidding. I love this procedure because it does really help with grinding your teeth at night. It also slims this area. It's really beneficial. How is that compared to the other areas?
Not as bad.
Not as bad? Okay.
The middle of the eyebrow is definitely the spiciest.
I know. So a common mistake that people make is they sometimes inject this too high, and then it can actually get the smile. So we want to avoid injecting high and stay down nice and low where the muscle is. That's it, you guys. If you're interested in this, check it out, Daxify. It's a newer modulator. It lasts a little bit longer. It gives your skin a nice glow and it kicks in faster. What do you think so far?
I love it so far. I'm really excited to see the results.
Cool. We can't wait to see what she thinks afterwards. Probably 3 to 4 months from now, we'll check in again. All right, cool.
Thank you so much.
You're welcome. All right. This is our beautiful patient. 3 weeks ago, she fell and hit her nose on some concrete. So she has a dorsal hump here. She's going to turn a little bit for us all the way to the side so you guys can see that better. It's basically right here. Okay, so we're going to do this procedure all through a nostril and go in and basically file down the dorsum of the nose to make it straight. Okay, so pretty straightforward procedure. Stay tuned. Okay, there you go. Whoa. Little swollen right now, but that's going to come down even more.
Oh my God, it's like totally gone. No, it looks really good.
Good.
Yeah, it's really good.
Good.
I found Dr. Barrett through social media. I needed to get this done very quickly, and he was able to accommodate that for me.
He had a more holistic and healthy approach. That kind of resonated with me because I'm not trying to devastate my body.
Dr. Barrett is definitely special because the way that they treat us, not only Dr. Barrett, he's awesome. All the staff is great. The girls on the front desk, everybody was so nice to me that I think this makes all the difference when you're going through a process like surgery.
The way that I see myself now when I look into the mirror is a completely different reality. This feels like actually the true me.
He's not going to talk you into anything he doesn't think you need. He's not going to suggest anything unnecessary. He really wants what you want.
Everyone's like, oh my gosh, you look so natural. Like, it looks like you've never had surgery. It's really just been a great boost in my life as a whole. And
I love everything that I had done. I love my boobs so much. They're perfect.
My nose looks way better than it did before the accident.
Absolutely love my body now.
I think the changes that you want to make to yourself, if they resonate with who you are, can bring out the confidence that you didn't realize you had.
Here's why you should be using red light on your skin, at least your face, daily. I'm Dr. Barrett, I'm a board certified plastic surgeon, and this is a red light therapy mask. It's one that I actually created. And red light, especially 660 nanometers, has been shown to increase blood supply to your skin, your face, reduce wrinkles, increase collagen and elastin. I took a regular face mask, normal power, and I supercharged it to make it super bright, so it's actually much more effective. I use red light on my face 10 to 20 minutes every single day. I recommend you do as well. I also, because I'm a surgeon, I do post-operative recovery types of things too. So if you had facial surgery or facial procedure, you want to use the orange setting. And then lastly, if you have acne, you want to use the blue setting. Okay, this is for 20 nanometers. This has been shown to decrease acne. So if you're having an acne breakout, do a little setting on the blue and then kick it over to the red. All right, so this is my Barrett Recovery LED Therapy face mask. You can get it on my website, postoprecovery.com, and basically your instructions for using this is basically morning or night. If you want, just put it on your face like this. While you're reading, we got these little eye holes here. It is actually safe for your eyes, so you can expose your eyes to red light, and it is safe. Actually, it's been shown to improve vision. It's got a silicone smooth texture on the inside that actually helps kind of smooth out creases and wrinkles, and you'll notice a difference typically within 7 to 10 days of starting to use red light, and you'll feel pretty good too, especially if you're in an area that doesn't get a whole lot of sunshine. You might get a little circadian boost as well. Let me know if you've had any success stories with red light.
Hi, Charla. How you doing? Good. How are you? Good. You ready for today?
Yeah.
Give me a hug. All right. It's a big day.
Face and neck lift, total facial rejuvenation. Our patient is 46 years old. We're going to do a combination of treatments that are going to work together synergistically to restore the youthfulness of our patient. Okay, so we're going to do a combination face and neck lift. Okay, all of this volume under here is going to be gone with our neck liposuction portion, but then we're going to resuspend to get rid of that extra skin. That's really important. The other important part is to do this in a deep plane, meaning that we need to get the submuscular aponeurotic system, the underlying tissues, in upwards direction, okay? Then redrape the skin. You don't want to do just a skin-only facelift. They only last about a year. So we're going to go deeper and get the deeper structures back to where they're supposed to be. You can see this jawline is going to be improved. The whole neckline is going to be improved. She'll actually develop to have an angle underneath here instead of a blunted kind of straight line that she has now. Then we're going to do some more advanced techniques like our facial fat grafting. So the areas underneath the eye, we're going to add volume, nasolabial lines, the corner of the mouth. These are called marionette lines. A lot of that's going to get corrected with the face and neck lift. She has a tiny little mole we're going to zap off to, in addition to the total superficial resurfacing with the CO2 laser. We're also going to get rid of the little bit of extra skin that she has in the upper eyelid using our blepharoplasty. So stay tuned, I'm going to show you how it's done. So we're going to get started with our laser. This is a CO2 laser, and I just want to show you, this is our Deep FX. I want to show you that grid. That is penetrating deep into her dermis. Is going to further tighten her skin and allow us to resurface this. We'll also do the active FX after this. Everyone, this is our patient. She is only 4 weeks out from her facelift, neck lift, upper blepharoplasty, CO2 laser, facial fat grap. She looks fantastic already at 4 weeks. One of the things I like, if you come here onto the side, you can see that she's healing here from her incision, but you can't tell that she actually had a facelift. So that was kind of how we do our no scar technique, where we go behind the ear tragus here and hide it into the junction of the ear so you really can't see it. You can actually see it better on this side over here. This all is hidden in the hairline and right behind the ear, so no one's gonna, have you even said this, if somebody said that they haven't been able to tell that you had a facelift?
No.
Yeah, and it's still kind of healing the incision, so that's great. So in another 6 weeks, a lot of the swelling is going to be down, but already a beautiful result, nice fullness in the face. The skin tone is incredible. I think we got rid of a mole extra as well.
You got some over here, down there.
Yep, the neck is now tightening up. You see there's a little bit of swelling still residual.
Chickenpox scars are gone.
Chickenpox scars are gone, all right?
That was good bonus.
Yeah, so all in all, she's still really good. There's still some muscle weakness on one side that happens after a facelift. That's going to correct over the next few weeks as well. So you need a breast lift operation. There are 2 ways to do this, okay, in terms of scarring. There is a anchor scar. A lot of doctors do that. We learn that in residency. And then there is the lollipop scar, okay? This is a newer technique, all right? I think that the anchor scar is archaic. You should avoid it like the plague. A lot of surgeons do it because it's what they know how to do. It does work, but it relies on the skin, creates a skin brassiere operation. According to Elizabeth Hall Finley, she's the maker of the lollipop lift. It creates a flat and boxy appearance of the breast. Way worse scars on the bottom. Doesn't rely on the breast to lift the tissue. As opposed to a lollipop incision, you don't have the horizontal on the bottom. You can do liposuction on the side if you need to. Treats the breast as a 3-dimensional structure so it doesn't look flat and boxy, and the lift lasts much longer.
My name's Charity Lawson, and you might know me from The Bachelor, The Bachelorette, and Dancing with the Stars. I am here today for a breast augmentation, and for me this is something that I personally wanted to do for a really long time. I thought about it honestly for like 10 plus years, so didn't want to get it while I was too young. So having the opportunity to just kind of sit on the decision and making sure that I was in the most comfortable place in my life, but also feeling really confident and at peace with my decision is why I'm here today. And so Dr. Barrett is going to be doing that for me and taking really good care of me. So I'm super excited, a little bit nervous, but mostly excited.
Hi. Good morning.
Good morning. It has been 4 days since my surgery, and so far everything has been absolutely phenomenal. I truly could have not asked for better results, and even like the recovery time, like I had minimal downtime to be honest, and there was a little bit of like tightness and swelling, which is normal, but as far as it goes with like the medicine and everything that Dr. Barrett gave me to like aid in my recovery, it made it so much better. Honestly, I love the results, and I know like I still have ways to go for them to like fully be there, but the fact that I'm already like, okay, yay, they're great now is a huge testament to his work, and I honestly just am so excited to see that come. So obviously I live in Brooklyn, New York with my fiance Dotton, and so we came in, we had other obligations, but it was perfect timing for me to like kind of schedule this or put this on my schedule. The fact that I am able to still come in while I have a flight in a couple of hours to still see Dr. Barrett and him give me continued care while I also get ready to fly back is really helpful, and I just love that he has this approach to where, you know, no matter where I'm at, flexibility is there. He is a phone call away to just kind of discuss things if I have any problems come up, but as of now, we're all good.
Oh, you look fantastic. It's like,
I know.
It's like, did you really just have surgery?
I know. Good, and
It's like, get out of my office. It's like, you didn't have surgery.
No, all is well, and
Good.
I'm really happy.
Good.
Yeah.
So we're here, we're week 1. You did great. All right, so we did differential sizing for her. We did pocket tightening on the right side. She had a little bit of a chest wall fullness on one side, so we were able to put a smaller one on that side, a bigger one on the other side. Looks great, I love it. She's healing great this week 1. We're gonna take out some stitches, get her some red light, and get her going today.
2 weeks in, and I have been recovering so well. I honestly, like at this point, I feel like I can conquer the world, which is crazy to say because I know I have like weeks left in my healing journey, but I've already like started to feel like really comfortable with them and just like no pain at this point. Like it really has been a breeze, and I could have not asked for a better experience. Like honestly, I'm really happy. I'm thrilled. Like if you can't tell, like my confidence and just like my overall demeanor has like improved so much, just because I know like this is something that I really wanted to do, and I'm really glad and confident and happy that I did like follow through with my choice. And so now just like obviously with everything that comes with it, and even like the recovery of it all has just been such a breeze that has just confirmed like this was the right choice for me. The CBD balm that Dr. Barrett gave for post-recovery has been truly my holy grail. It is like liquid gold for everything that you can imagine. I apply it obviously for whenever I'm feeling like a little bit tight. Obviously I'm 2 weeks out, so still kind of like going through that initial like phase of like feeling things and getting used to them. But whenever I like have just like an urge, I'm like, oh gosh, I feel like it's getting tight or like a little bit of swelling, I use this, and then a few minutes in and I feel good again. So like when I say like I use this, and even Dotton, he didn't get nothing done, but he uses it and applies it, so it's really that good.
Good to see you.
Good to see you.
How's everything?
Good.
Good.
Feeling good.
All right.
Yeah,
Wonderful.
yeah. For anyone who is thinking about getting a surgery like this done, I definitely will say obviously do your research. For me, I really wanted to come to a doctor who had a holistic approach like Dr. Barrett, which made me feel so much better, like I was in really safe hands, not only about the surgery, but my overall wellness after and my recovery. So knowing that is like a huge thing, but also like taking everything else into consideration, like if you know you're scheduling, what that looks like, if this is going to be a good time for you, but like ultimately, like if this is a decision that you want, do not let anyone sway you from that. Life is too short to like worry about what is going to appease other people. Truly do what's going to make you happy, obviously, and healthy. So do what's best for you and take that leap of faith.
How do you know if you need a chin implant? Dr. Barrett, board certified plastic surgeon. Well, if you've been thinking about it, there's a chance that you might actually need it, right? Because a lot of times people think that they need neck liposuction, and that might be the case. But if you notice where your chin is, right? So if you put like a popsicle stick or something like a ruler right here, where does your chin relate to your lower lip, right? You kind of want it to be right in line with it, or maybe just a little bit behind. If it's way behind, if it's like a centimeter behind, you could benefit from a chin implant. And why that's important is maybe it's the chin projection that's lacking and not so much neck fullness. Instead of getting neck liposuction, you get a chin implant, or why not just get both? And you get the best of both worlds. We do that quite often, and a lot of people don't realize that they have micronathia, and fixing that actually improves their tech neck more than anything else.
I am a personal trainer, and I work with a lot of clients who go through weight loss transformations. I went through one of my own, and when I had lost a bunch of weight, I had some extra loose skin that just kind of natural. I really wanted to kind of improve my own confidence, and so I'm getting a little bit of a tummy tuck. I think it's really important to love your body no matter the skin that you're in, but knowing that I can kind of go out and feel confident in my own body, that's the most important thing for me.
So our swelling is looking normal at 6 weeks, especially with the chest reduction. We did a male chest reduction, my specialized procedure, where we only use a little incision here, and then we did some liposuction here on the side. So overall, this is looking really good. And another 8 to 10 weeks, a lot of this swelling is gonna disappear, and it's gonna have a great final result. Dr. Barrett, board certified plastic surgery. These are my 5 skincare must-haves. I have my exfoliating cleanser, exfoliating polish, daily power defense, vitamin C serum, and retinol skin brightener I use at nighttime. The reason why I use this Abaji line is because it is simply the best I've found out there. So you can go to Neiman Marcus or somewhere else, spend a bunch of money, actually more than you would expend on these products, and they're gonna do a lot less for you. In fact, they might even harm your skin. A lot of people over-moisturize their skin. That's the wrong way of doing it. You wanna kind of challenge your skin, get that skin to start to turn over, to get rid of that dullness, and be more healthy. If you want stronger muscles, you go to the gym. The same is true for your skin. So that's why I recommend these products. I use all these every single day. And then this retinol brightener, this is the heavy hitter. I do this about every 3rd night. So check it out. Ask us questions if you have about these products and see if they might be right for you.
So today I am getting a breast augmentation, and I would say I've been considering it for probably since my mom got her boobs done. So I was like, what, I was like 10 or 9 or 10, because I knew I wasn't gonna get any ever. So I was like, that's probably my best route. I did a lot of extensive research. I know I looked in the Bay Area first because that's where I'm like located, but I knew that I wanted to go somewhere, one, they specialize in like natural results, because that was like a huge thing for me, and Dr. Barrett is like known for his natural results, so I was like, he's probably the perfect choice. And I think he was the only doctor I actually did a consultation with, and I was sold as soon as I did my consultation. I would say definitely go to a doctor that's well versed in their field and knows a lot. During my consultation, I was able to get a lot of information, even if it wasn't necessarily just about specifically what I was getting done, but you know, just like the follow-up process and just going somewhere where you're trusted. Like, I have no anxiety going into my surgery, and I'm super comfortable and just more so excited to wake up with my results. So I'd say going somewhere where you definitely trust the doctor and they know what they're talking about.
We're going to put an implant underneath the muscle. We're going to do all through the border of the areola incision. The hardest part of this operation is getting this natural looking pocket placement. We're going to use a silicone implant for her, and we're going to size it on the table in the operating room. We're probably going to be around 250 to 300 cc's. That's our range, probably, based on her measurements, so that we can get a nice natural looking result that matches the rest of her body. Natural breast augmentation recap. We were able to go border of the areola incision. That was the toughest part here. We created a pocket for her. We tried 275, it was too large. We went down to 250, that was a much better size for her. We used a moderate profile. You wanna stay away from the high profile, they tend to look very fake, all right? High profile doesn't mean up here, it means out here, okay? So a lot of people confuse that. If you want up here, it's actually better to go with a more moderate profile implant because it actually widens out, right? Final result, she's gonna look great. It takes about 6 weeks for them to drop and settle. Time off, 4 or 5 days, she's gonna feel great. We put that long-acting pain medication in there. Questions about this procedure, check out my website, breastbybarrett.com or drdanielbarrett.com. We have virtual consultations, so if you're interested and wanna know what I think, submit a virtual consultation on our website. Also leave your comments, questions, feedback here on my YouTube page, and give me a thumbs up and hit subscribe if you wanna see more cool videos just like this. Thanks for watching.
So far, I feel great. Literally the very next day, I was like perfectly fine. I remember I went to lunch and they were like, oh my God, you feel great, your surgery was yesterday. And I was like, yeah, I literally woke up and I had like no pain. It's really just been staying on top of my meds, because I think that's what really been helping me, and like the CBD oil and everything. Everything was pretty easy when I got here. It was super seamless, just because I had multiple conversations going up to the day of my procedure. So there wasn't anything that was shocking, and there wasn't any questions that I had that day. So I was very calm. I would say definitely just do your research with your doctor. Dr. Barrett was the only doctor that I had seen for a consultation, and then I knew at my consultation this is the doctor that I want to go with because I had done prior research. And then just asking those questions beforehand too, because I feel like the least amount of questions that you have going in, the more comfortable you'll be like day of surgery. I didn't have any jitters or anything like that, which I know a lot of people will say is common with surgery, so. It's been really smooth. I don't think there was any part of my recovery where it was like hard or I was like not loving my results. Like even straight after surgery, I was like fine. Like I didn't have any bruising or swelling. So I pretty much was already in love with my results like as soon as I hopped off the surgery table. I feel like they started dropping earlier than the 4-month period and like the 3-month mark. So I was already kind of like, oh my God, is this it? And they're like, no, they get even better. So I'm excited to see what it'll be like at 6 months, but I'm in love with the 4-month results already. I did both flying, like today I flew in like this morning, but I've done both flying and driving, and both have been pretty easy. Like even after surgery on like the drive back, I was fine. Like there wasn't any like motion sickness or anything, because I know sometimes nausea is like a symptom after surgery. So I was great with that and everything, and it's been very easy because you know, they give you the option to either do it over Zoom. I just prefer being in person so I can get like everything that I need to know. Like if I have any questions, I feel like I always forget. So I have everyone here to help me.
So here's our patient. She is 4 months out from her breast augmentation, you guys. She was worried about having this look natural because she has such a petite body. We did 250 cc's both sides. She has beautiful cleavage. It's very natural looking. She has a little bit more time for them to kind of drop and settle, but for the most part, she is good to go. Nice teardrop shape, beautiful home run, natural looking breast augmentation.